Today, we're going to open the door to the heart, and I mean that quite literally. We're talking about the mitral valve. It's this small but incredibly important part of our heart that can cause some really big problems when it's not working right. So let's dive in and see what happens when this critical little door starts to fail. I want you to think about the most important door in your house for a second. What if it got stuck and you couldn't open it all the way? Or what if it was warped and just wouldn't close properly, leaking everything through? Well, believe it or not, this is exactly what can happen right inside our own chests. We're going to explore this right now. So the mitral valve is basically the perfect one-way door. It sits between the heart's upper left chamber, that's the atrium, and the lower left chamber, the ventricle. Its job is super simple, but absolutely essential. Swing open to let oxygen-rich blood move forward, and then snap shut tight to make sure none of it goes backward. That's it. Simple, right? But so critical.
Okay, let's talk about our first problem. What happens when this door gets stuck? Well, there's a name for that, mitral stenosis. It's when the valve gets all stiff and narrow and it makes it really hard for blood to get through.
Now, you might be wondering where this comes from. Most of the time, it's actually a long-term consequence of having had rheumatic fever. What happens is, the fever can cause the flexible flaps of the valve to scar up and basically fuse together. Medically, it's called commissural fusion, but you can just think of it like the edges of the door getting glued to the door frame. And that fusion creates a really distinct look. The valve opening, instead of being nice and wide, becomes this little narrowed slit. And doctors have a pretty vivid term for it. They call it a fish mouth abnormality. You can just picture that, can't you? You can see how that would seriously restrict the flow of blood. And the consequence of that stuck door? It's just simple physics, really. You get a traffic jam. Blood just can't get through that tiny opening fast enough, so it starts to back up, and the pressure builds in that left atrium behind it. That chamber has to work way harder, and the pressure just keeps rising.
All that pressure has to go somewhere, and that's what causes the symptoms you see here. The very first sign is usually getting short of breath when you exercise. That's dyspnea. As the pressure keeps backing up into the lungs, it can cause high blood pressure there. It can even push on a nerve that goes to your voice box, making you sound hoarse. And in really bad cases, tiny blood vessels can burst, causing you to cough up blood.
Now here's the amazing part. A doctor can actually hear this traffic jam just by using a stethoscope. It makes a very specific sound, a low-pitched, rumbling noise that happens when the heart is supposed to be relaxing and filling with blood. It's literally the sound of a struggle, the heart's cry for help. So that covers a stuck door, but what about the total opposite? What if the door isn't stuck shut at all, but instead it's leaky and it won't close all the way? Well, that's what we call mitral regurgitation. The cycle here is just so frustratingly inefficient. You have the powerful left ventricle squeezing with all its might, trying to pump blood out to your entire body. But because that door doesn't seal properly, a whole bunch of that blood just shoots right back where it came from, leaking backward into the left atrium. And that backward leak, it creates a huge problem. The heart is basically forced to pump the same blood twice. It's working overtime every single beat. And over months or even years, that extra workload can just completely exhaust the left ventricle, causing it to get bigger and eventually to fail. And just like our stuck door, this leaky door has its own unique soundtrack. But instead of that low rumble, a doctor hears something totally different. A high-pitched, soft suff, kind of blowing sound. It's the whisper of blood going the wrong way. The sound of inefficiency. So, we have two very different problems happening with the very same valve. One's stuck, one's leaky. Let's put them side by side, head to head, and really see the differences. The sounds are just night and day. You know the classic lub-dub of a heartbeat, right? That first sound, the lub, is what we call S1. With a stuck valve, stenosis, that lub sound is loud, and it's followed by that low rumble. But with a leaky valve, regurgitation, that first sound is soft, and it's followed by that high-pitched blowing sound. They have totally different audio signatures. So here is the bottom line. With stenosis, the stuck door, the problem is getting blood out of the atrium. This leads to that pressure backup and shortness of breath. With regurgitation, the leaky door, the problem is blood leaking back in, which leads to this volume overload that just wears out the ventricle over time. Okay, so we get the problems. But what do we do about it? How do you possibly fix the flow when the heart's main door is broken? For a stuck valve, the treatment is kind of like a ladder. You start on the first rung with medications, to manage symptoms and prevent dangerous clots from forming in that blood traffic jam. If that's not enough, you climb to the next step, which could be a procedure where a balloon is actually used to stretch the valve open. And if the valve is just too damaged, the final option is a full-on replacement.
Now, with a leaky valve, things get a little bit trickier. The big question is all about timing. See, a person can feel totally fine for years, while their heart is quietly overworking itself into exhaustion. The real challenge is deciding when to step in with surgery before that damage becomes permanent.
And to help answer that really tough question, doctors have this fantastic guideline. It's actually elegantly simple. They call it the 60-40 rule, and it's all based on two key measurements of the heart's health.
The first number is 60. You've got this thing called ejection fraction, which is just a fancy way of saying how efficiently the heart is pumping. It's like its power rating. If that efficiency rating drops below 60%, that's a huge red flag that the heart muscle is starting to get tired. It's time to go in and fix that leak.
The second number is 40. This one's more straightforward. It's about the actual size of that overworked left ventricle. If it starts to stretch out and grows bigger than 40 millimeters, well, that's a physical sign of damage. So even if the person feels fine, that 60-40 rule tells doctors it's time to act. So we figured out how to listen for these broken doors, how to measure their failure, and even how to repair or replace them. But really, the ultimate goal has to be prevention, right? As we get better at understanding genetics, as our technology gets more advanced, you have to wonder, could we move beyond just fixing the problem and actually stop these critical doors from ever failing in the first place? It's a question that drives cardiac research forward every single day.